healthcare system is in distress. Overworked doctors, poor working conditions, and a mass migration of medical professionals, often referred to as the Japa Syndrome. They have left hospitals struggling to provide adequate care. The consequences: overcrowded facilities, doctor shortages, and an increasing burden on the remaining healthcare workers.
And what must be done to fix this crisis? Well, today we speak with a key stakeholder at the heart of the issue, Dr. Benjamin Olowojebutu, the first Vice President of the Nigerian Medical Association. He joins us to shed light on the struggles doctors face daily, the impact on patient care, and the urgent reforms needed to salvage Nigeria's healthcare system. You're welcome. Thank you very much for joining us.
Thank you for having me today again. How are you?
Grand.
Happy New Year.
Happy New Year to you.
Yes, indeed, you have it. We're also going to be joined by another guest, but first up, we're going to kick off with the doctor in the studio here. How bad is our system currently? Let's start from there before we start to nitpick.
Very, very, very bad. I don't think it's getting better. I think every day there's a push and pull factors that is sending people away from our country, which means, you know, people have access to an enabling environment abroad. They see how life is. They can eat properly. They can send their children to proper schools, you know, because they are being appreciated for what they work for. But in this country, we don't see that happening yet, where doctors work so hard and earn so little, and there's a lot of issues happening around accountability. So you tell us about budgeting in healthcare in Nigeria. You say this is how much money you use for budgeting, infrastructure, remuneration, training, but those budget doesn't translate into affecting the life of doctors, of healthcare workers in the country. So you see this very big budget, but you don't see the real work. So for example, you say you have a federal teaching hospital. A teaching hospital is meant to train people. I get my point, training people. So you now have departments in the hospital that don't have doctors. So what are you training? Why is it called a federal teaching hospital? So you create a budget for that training, but the doctors don't have to train. So the effectiveness of our budgeting system must be looked at. Number two is that you have to look at the WHO ratio. Normally it's just one doctor to 600 patients. That's the standard. But right now we have one doctor to about 7,000, 8,000 patients because of the mass exodus of doctors in this country. And we're not addressing the real issues. Welfare of these medical doctors, wealth of the healthcare workers. Nobody's talking about it. You know, we have great ideas, lots of ideas about how to improve access to healthcare. But who's going to give this access to the healthcare? You can't give access. You can't say you're accessing patient care, rural communities. You have 7 for local government in Nigeria. You want one doctor per local government. But are you saying what are the adequate remuneration for these doctors? Safety nets. Are they going to be kidnapped? Are they going to be harassed? Are they going to, do they have insurance, life insurance? Doctors die at call of duty, and after that, that's all.
Speaking of which, there was one such instance, wasn't there?
Yes, indeed. Well, we're now joined by Dr. Victor Alamu Oalami. Hopefully I got that correctly. He joins us from Birmingham, UK, live. Doctor, many thanks for joining us. We appreciate you for doing this with us. We've got two medical doctors, much more younger, all the way from the UK, and here with us in Nigeria as well. And we're going to come to you about the story that trended regarding the doctor that died. Can you give us a bit of a backstory, because that's really what sets the premise for this discussion today?
Good morning to everyone, and thank you for having me. About the doctor that died, Dr. Joseph Madu. 3 days ago, we got the news that Dr. Joseph Madu, who was a dedicated Nigerian doctor, news was circulating of his death, and it was attributed to the fact that he had a chest pain, and unfortunately he sought for sick leave, which was denied. That led to his unfortunate death. But I think this is the right avenue to clarify, because after the story went haywire, and haywire, I decided to ask, close family members or those who were close to Dr. Joseph Madu to see the real story behind it. And what we came up with was that unfortunately, this is not one of those incidences where we have a medical doctor succumbing to stress as we have had in the past. And I think it's best that we take it from now on that Dr. Joseph Madu did not die because of that story. There is indeed a doctor who was sick and sick for a sick leave but was denied. That in itself is an issue to discuss, which is paramount to our discussion today as well. But I just thought that it's best. He was sick 2 months ago. He fell ill, and later on he was given. He has been on leave. He decided to come back to work himself, and afterwards, despite all efforts by healthcare professionals to save him, he died eventually. But this doesn't stop the fact that there are a lot of doctors in the past that have died due to this stressful working condition in Nigeria. Over prolonged working hours, they are overburdened with work, they are underpaid, they are undervalued. I mean, if you look at in September 2022, we've had a report in Lagos where 3 senior medical doctors in Alimosho General Hospital were reported to have died under what colleagues, described as demeaning circumstances. In same September 2023, there was a doctor in Lagos Teaching Hospital that died under a circumstance that was blamed on stress by his colleagues. He was on call for 72 hours without break. That was Dr. Michael Umo. There are also several deaths of, a 26-year-old female doctor who crashed, in a lift from a 10-story building in Lagos. All this shows you, the fault in our healthcare system that leads to these medical doctors, succumbing to death. Okay. Stories of doctors who have died due to, committing suicide and all of that. So
just a second. Let's come back into the studio here to talk with Dr. Benjamin and ask about these conditions that doctors in Nigeria actually are working in. What exactly are these conditions like? I heard you mention something about health insurance, which you would think that doctors shouldn't have a problem with because they're doctors themselves. And then this story of Dr. Madu, who passed away after being sick and being denied sick leave. What could cause an establishment to deny a doctor sick leave? Is it because of the volume of patients or work that's on the ground?
That wasn't the right information. You just corrected it, because I also asked questions. He was sick. He had some bone marrow failure syndrome that happened to him, and he wanted to just come back to work as well. He was very bored, and after he came back to work, he had issues. But that doesn't stop the fact that this happens. Now, let me give you a scenario. The CMDs of hospitals most times are driven by profit, are driven by how much IGR they can make. They keep saying that they don't have adequate money to fund the system.
CMD
Chief Medical Directors, which are the people that are the federal government's appointees to run the hospitals. Federal government hospitals, basically, teaching hospitals, federal medical centers, federal institutions, as the case may be. Now, because they run the hospitals by IGR profit, most times they don't look at what is the extent of workload on those bringing those income. For example, let's assume 10 doctors in a clinic sees 1,000 patients on a Monday clinic, normally before, because they say one doctor maybe sees 100 patients. And you have that 10 doctors depleted to 5 doctors because of Japa, because of whatever, maybe they're retired and everything. Now you have 5 doctors now, but they still want that 5 doctors to see the same 1,000 patients. One, you're going to stress the doctors. You're going to make them make mistakes because they're going to be tired. They're not the adequate seeing of the patient properly. Because you are driven by profit, you don't think about it. So for me, I say leadership is not about being in charge. It's about taking care of those you are in charge of. How well do you make them see that patients and tell the public, sorry, we have 5 doctors now in this place. We can't do 1,000 patients anymore.
Where do they go? The patients?
We'll do 500 patients.
But where
no, so this way I look at it, as you know. If you think about the people that offer the services, and you can give adequate explanation to the public, you can stagger the clinic and say, okay, somebody come on this Monday, other come on the other Monday.
Okay.
But you don't think about the patient. You don't think about the doctors, the healthcare workers. You think about how much money can come into the coffers of the system.
Because you're driven by profit. But what is the NMA doing about this?
That's what we're doing. Now, what we've done...
Something has been put into plan, into action?
Yes. Before, there used to be bureaucracy on how doctors are employed into the system, where you have to go to the head of service of the nation to get approval to employ anybody that leaves the system. Now, that bureaucracy has been taken off. So there are waivers. If there are employment opportunities in the hospital, there are waivers not to employ through the Federal Ministry of Health instead of going to the head of service before. Now, but some people still don't use the opportunity. Imagine a hospital in Lokoja, Federal Teaching Hospital in Lokoja, casualizing doctors, giving them on locum, which means a doctor had been employed for 5 years in this hospital. 5 years, some doctors. And they're on the same salary scale for that 5 years. No leave, no promotion. They are victimized because they're not telling you, this is a Federal Teaching Hospital. You have the opportunity to train resident doctors, you have the opportunity to see more patients. But you have some department ask no doctor, ask no resident, and they're getting this funding from the budget of federal government. How much are they accountable? Those are my issues. So the CMDs are like, sometimes they're like emperors, demigods. They're the ones that oversee the hospital, but they're not answerable to anybody. You know, I get my point. So the patients now look at the doctors that you don't want to see them, but they're not seeing the doctors as also being patient, that they can fall down there. I've seen doctors doing ward round in teaching hospital like in Benin, died on doing ward round because they were stressed. I get my point.
Yeah.
Doctors need, the system is not helping doctors grow. I know in the past, you know, if you have research opportunities to go abroad, you can go abroad and learn few things and come back to Nigeria and invest. Most of which all of our professors enjoyed in the past. You can say, okay, you want to go and do maybe some specialty training in the UK and the US, even sometimes funded by the federal government. But now the opportunities are not there anymore. Now they've told you that if you want to go and do any other training abroad, now you have to resign your job where you're working. How do you improve yourself? So the environment is not enabling at all. It's just work. No workplace policy, no value for what you are doing, no respect.
So does your association, and then how does this association come in? Because I like to think that one of your tenets or your
welfare,
your responsibility is welfare of the doctor, right? And I can only imagine that the Japa Syndrome as well must have even made it harder in terms of ensuring that, I mean, with the exit of all those doctors, the doctors are dwindling, meaning that the ratio between patient and doctor expands even more, which makes it difficult for you guys to be able to ensure that the welfare of these doctors, just as an all-round way, how hard is it, and what have you been doing in just helping with, the welfare of doctors?
So as I've said before, one of the things we've done is to help relieve this bureaucracy. There are doctors that want to be employed. That's one thing. Every year in this country, we have about 7,800 in medical schools. There are those doctors that already finished medical school now.
Here in Nigeria. Okay.
So they are available.
So they are available. So
sometimes there's a lot of corruption in the system. A lot of wrong.
Just a second, we have a bit of technical issue with your device here. We're going to fix that, but while we're fixing that, let's turn to our guest on online video. So, Dr. Mina, now, you are outside the country. May I ask, I have a series of questions to ask you. May I ask what the conditions are like outside the country first?
Thank you for asking that. So, as you know, I'm here in the United Kingdom, and the UK, there are reports that the UK has 25%, the 25% of NHS workers, healthcare providers are from Nigeria, comprising of the doctors, nurses, medical lab scientists, healthcare assistants, and all of that. The working conditions in the UK, as my first vice president, well said from the beginning, is all about the pulling factors that they have. And one of the pulling factors that they have is, a conducive working environment where you earn well, you can take care of your family, you have security, both job security and, environmental security. You can also have professional growth where in terms of trainings and all of that. And the most important one is also about the working environment. That is the working hours, equipments for you to use to save patients' life, because you know how to save patients' life. But when you don't have those equipments in place, it's still an empty case for you. So these are the the things that are available that make working around here in the UK, very good. For instance, let me give you an instance. The working time directive, when we talk about the working hours, the working time directive in the UK does not allow anyone to go above 40 hours per week, whether you are in the public sector or the private sector.
That's very interesting. 40 hours a week is the limit at which you can work. So there are these things that are put in place.
That you have to work. And any employer would have to follow it, regardless.
All right,
and unless if you opt out yourself.
All right, so Usman, are these the conditions that led you to leave Nigeria to the UK?
Definitely. It is a difficult question to answer. There are a lot of reasons. For everyone, I believe, who leaves Nigeria, as a doctor, for us, it's not just about the money. Many, of course, would say it's because about the money and all of that. But deep down, we are committed to, first of all, serving our own people back home. And that is why it is important for us that we see, our country working better. To answer your question, whether it is definitely one of the main reasons, because if you keep working, trying to, give your best in a country where it doesn't seem like it values you or what you have or your professionalism, definitely passion at the end will fade away and you would be pulled towards where there are good, offers for you. And doctors, of course, have offers, everywhere around the world. And so it's easy for them to just move away. As bad as it is for our country, and that is why we're trying to see that we come and have a seat and discuss all of these issues, so that at the end we find sustainable solutions to all of them.
So, Dr. Usman, I'm told that you have a word for doctors that you would like to pass across. Let's give you that 1 minute right now.
Thank you very much. This is not only for doctors, it's actually for everyone in Nigeria, and I just hope you give me your ears. So to everyone watching today, on behalf of all the Nigerian medical doctors, I want to emphasize the importance of addressing the working conditions of medical doctors in Nigeria. The call to abolish the practice of having doctors continue working the next day after 24 hours in hospital call is not just a matter of policy, it's a matter of life and death. A tired doctor is a dangerous doctor, and their fatigue poses a significant risk to our healthcare. We must acknowledge that doctors deserve rest between their duties. They are not just healthcare providers. They are human beings deserving of dignity and respect. When a patient loses their life, the pain felt by their family is profound. And while they may find a way to heal over time, the weight of that loss lingers with the doctor forever. Each life they strive to save is a reminder of their commitment to the Hippocratic Oath. It is our responsibility to ensure that their mental health is protected, so they can continue to provide us with the best care possible. By advocating for better working conditions, we are investing in the health of our communities and honoring the sacrifices our doctors make every day. So I call on all of us to stand together to support our healthcare providers, ensuring that they have the rest and respect they need to keep saving lives. Thank you.
Thank you very much.
I'll let you have as excellently put. You have the final floor. You are in charge of the NMA, which is Nigerian Medical Association. Your final say.
I've known Ani for a while. We've been talking. I think it's important all of us as a people in this country fight against tyranny in medical practice and also fight against unaccountability. I think if we now begin to use our budget properly as value to impact on the healthcare workers, it makes it better for us to impact the community. I don't see why a medical director would victimize his colleagues because he was once a young doctor, and because doctors are now protesting, you are sacking them, or you're trying to victimize them. It happened in Federal Teaching Hospital in Olowojebutu. Dr. Labi is the CMD. I think he has done that couple of years, casualizing doctors, victimizing them. These are the reasons why the doctors won't go to that place anymore, because it's already they are pushing them away. I want to say what I said. Let all of us as a people, we must stand against health. Is the right of all Nigerians. If all of us as a people don't stand for it, we're not going to move forward as a country. So please, Nigerians, help us speak to the matters. Let's improve the adequate working environment of doctors in this country, and let's give value to healthcare workers, because health, they say, is wealth. Thank you very much.
Health is wealth indeed. Gentlemen, many thanks for joining us. We appreciate you for coming on. To Dr. Usman Alamu, and as well as our very own, the first Vice President of the Nigerian Medical Association. Thank you both, gentlemen, for joining us. We appreciate you.